Did you know over 50 lakh Indians are successfully managing their diabetes with insulin? If you or someone you love is struggling to manage diabetes and have been advised to start insulin, you are not alone. Hello everyone. Today, we'll discuss why insulin therapy is important to manage diabetes and how starting insulin treatment can be easy and smooth. To help us, we have a diabetes expert here. Hello, Dr. Ibrar. Thank you for joining us today. Doctor, whenever you prescribe insulin to a patient, the common question comes into a patient's mind is why insulin? Why their previous medications are no longer sufficient? And what are the added benefits of starting insulin? Could you please brief on this?
In a broader concept, we see that diabetes is mainly of two types. It's type 1 and type 2. In type 1 diabetes, necessarily we have to give insulin to the patients because there is no insulin production at all, or the insulin production is less, which does not suffice the insulin requirement of the patient. So, as type 1 diabetes, we have to put the patient on insulin, otherwise the patient will land in complications. And type 2 diabetics who are not controlled even on the maximum dose of oral hypoglycemics, or have renal dysfunctions, or the patients who does not tolerate oral hypoglycemics have to be put on insulin. And nowadays we are having better devices, better tools, better insulins like synthetic insulins, which help patients to regulate better glucose levels and minimize the complications, whether those complications may be micro or macro complications, and we can give a better quality of the life to the patients.
Thank you, doctor. We've understood that insulin helps to manage diabetes and prevent other complications. But still, while starting insulin, patients are having few more worries such as, how do I inject insulin? Can I manage it alone and feeling awkward to inject insulin in a public place, etc.?
See, when starting the patient on insulins, some points are to be considered and they have to be conveyed to the patients. Number one is the teaching and education to the patient. While insulin is important for the patient, and without insulin, what can be the complications to the patient is to be educated properly for that. Second thing we have to educate is the learning techniques of the insulin. So patient is to be educated regarding the basic techniques of the injecting the insulin. Third thing is regarding the hypoglycemias, which is very important and leading cause of mortality in diabetic patients. And importantly, the lifestyle management is to be explained to the patients. Lifestyle management means we have to educate them about 3+3 meal patterns, physical activity, calorie intakes, and do's and don'ts of the insulins. And the first 2 weeks are very important for initiation of the insulin, to rationalize the dosage of the insulin. And most important of all, the diabetics, whether it's type 1 or 2, whether the patient is on insulin or he is on oral hypoglycemics, lifestyle management is the mainstay of the diabetes treatment.
Very aptly answered, doctor. Like any other new things, insulin initiation can be learned and managed easily. But there are some more fear factors which needs your expert opinion. People have a common perception that injecting insulin is painful. It causes hypoglycemia, weight gain. It needs to be taken lifelong, and sometimes insulin is habit making. Is there any truth in this?
See, the successful insulin therapy is first the needle selection. Modern needles are incredibly thin and making the injections virtually painless. This is something new we are giving to the patients in terms of compliance of the insulin. Second thing is the right technique of the insulin, and to educate the people regarding the insulin techniques. We have to inject the insulin at 90-degree angle and rotating injection according to the grid patterns. That's very important for a patient to get educated. And the hypoglycemia management and understanding when the patient is prone for hypoglycemias and what should be done when he immediately feels hypoglycemia.
Thank you, Dr. Ibrar, for sharing the facts with us. I'm glad that you have presented in a very clear and understandable way. Surely this would benefit the viewers and encourage them for a hassle-free insulin initiation to manage their diabetes better. Thank you everyone and have a good day.